Alright, so the next worms that I'll be looking at is the hookworms. Alright, and I think hookworms is a very, after the tapeworms, hookworms should be the most popular type of worms, right? And you get to see this is how they look like, okay, with a folded neck, and that's why they call them hookworms, right? Because it can actually like hook up, all right. So in these hookworms, you get to look at the types, get to look at the life cycle, get to look at the symptoms of disease conditions that could be caused by hookworms. They'll look at the diagnosis, look at the possible treatments, the prevention and complications that could also be there, right? So we said that hookworms are mostly into two types. We have the Ancylostoma duodenale. I see from the word, from the name, you see that this one will basically what inhabit the duodenum. Okay. We also have the Necator Americanus. All these ones are parasitic nematodes that infect humans. Okay. So for the life cycle of hookworms, we say that um the eggs are ingested through contaminated soil, right? So probably any animal ingest them. Then later on you consume the meat of the animal that is undercooked or under processed, all right? So eggs usually hatch in the soil, release the larvae, or the larvae will now penetrate the skin. So you can actually get them from eating contaminated food. You can also get it from a direct contact with the soil. So one of the ways of prevention will be you should stop having direct contact with what? Contaminated soil. Okay, but the whole question now is how do you know if a soil is contaminated? Okay, so larvae migrates to the lungs. That's when it gets into you. They migrate to the lungs, then the intestine. The adult worms attach to the intestinal wall, then feed on the blood, right? So you see that the person will be dehydrated. Okay, the person will be looking malnourished because as you are eating, these worms are basically what taking up the food. So you could see their journey. They actually move to the lungs first, then the intestine. So in the lungs, you know that they'll be causing respiratory problems. So the intestine will be causing what? Gastrointestinal problems. Okay. So for symptoms, they'll be causing itching and rash on the skin. They'll be causing some respiratory system problems like what? The person will be coughing and wheezing. There'll be some abdominal pain. All right. There'll be what? Diarrhea, alright, that's passing of watery stools. There'll be weight loss, there'll be fatigue, there'll be anemia. Alright, all of these are present and all of these are common. Alright, diagnosis is um since the route of transmission is fecal-oral, that means later on you'll be passing out the eggs through the feces. So you could do stool examination, blood test to check if red blood cell levels are elevated or if there's anemia, right? Then imaging studies like what X-rays, CT scans can also help. Then these are the drugs combination for treating what infections from hookworms. So mebendazole, albendazole, and pyrantel palmate can all help. Prevention: always wear shoes in endemic areas. Avoid walking barefooted since these hookworms can actually penetrate the skin. Then proper waste disposal, improve sanitation and hygiene, then regular deworming can also help. Complications: it could result into what? Anemia, malabsorption, intestinal obstruction, respiratory failure, cardiac complications. All of this could be a problem. Okay, so you can see one infection from hookworms. See how it looks like. The skin is literally peeling off. All right. So I think that's a note on hookworms.